If you've ever wondered what foods to avoid with high blood pressure, then stay tuned because this video is for you. If you have high blood pressure, hypertension, it's important to manage your diet to help control your condition and reduce the risk of complications such as heart disease and stroke. Here are some foods to avoid or limit if you have high blood pressure. 1. Sodium, salt. High sodium foods are a primary concern for individuals with hypertension. Avoid processed and packaged foods, which often contain high levels of salt. Limit the use of table salt in cooking and at the dinner table. Be cautious with restaurant meals, as they can be high in sodium. 2. Processed and canned foods. These often contain hidden salts and preservatives. Canned soups, frozen dinners, and processed meats are examples of high-sodium processed foods. 3. Fast food. Fast food items like burgers, fries, and fried chicken tend to be high in sodium, unhealthy fats, and calories. Opt for healthier choices if you must eat at fast food restaurants, such as salads or grilled options. 4. Sugary foods and beverages. Excess sugar intake can contribute to weight gain and obesity, which can worsen hypertension. Limit sugary drinks like soda, energy drinks, and fruit juices. Reduce consumption of sweets, candies, and desserts. 5. Alcohol. While some studies suggest moderate alcohol consumption may have cardiovascular benefits, excessive alcohol can raise blood pressure. If you consume alcohol, do so in moderation, which typically means up to 1 drink per day for women and up to 2 drinks per day for men. 6. High-fat foods. Foods high in saturated and trans fats can contribute to high blood pressure and heart disease. Avoid fried foods, fatty cuts of meat, full-fat dairy products, and commercially baked goods. 7. Pickled and fermented foods. These foods can be high in sodium due to the pickling process. Limit your intake of pickles, sauerkraut, and other similar foods. 8. Red meat. High consumption of red meat, particularly processed red meats like bacon and sausages, has been associated with high blood pressure. Opt for lean cuts of meat and poultry and consider plant-based protein sources like beans and legumes. 9. Caffeine. While caffeine's effect on blood pressure varies from person to person, it's advisable to limit caffeine intake if it seems to affect your blood pressure negatively. Pay attention to how your body responds to coffee, tea, and other caffeinated beverages. 10. Excessive condiments and sauces. Many condiments and sauces, such as soy sauce, ketchup, and barbecue sauce, can be high in sodium. Use them sparingly or look for lower sodium versions. Most asked questions. Why is it important to avoid certain foods with high blood pressure? High blood pressure, or hypertension, can increase the risk of heart disease, stroke, and other health complications. Avoiding certain foods helps manage blood pressure and reduces the risk of these conditions. What is the main food item to avoid with high blood pressure? The main item to avoid is high sodium foods. Excessive salt intake can lead to elevated blood pressure levels. What are some examples of high sodium foods to avoid? High sodium foods include processed and packaged foods, canned soups, frozen dinners, fast food, salty snacks, chips, pretzels, and heavily salted restaurant meals. How much sodium should I limit myself to if I have high blood pressure? The recommended daily sodium intake for most adults is around 2,300 milligrams, about a teaspoon of salt. However, many health experts suggest aiming for even lower levels, ideally around 1,500 milligrams per day, especially for those with high blood pressure. Is it okay to eat any type of meat if I have high blood pressure? While lean cuts of meat and poultry are generally better choices, it's advisable to limit consumption of processed and red meats, bacon, sausages, and fatty cuts. Opt for plant-based protein sources like beans and legumes as alternatives. Can I have caffeine if I have high blood pressure? The impact of caffeine on blood pressure varies from person to person. In general, moderate caffeine consumption is considered safe for most people with hypertension, but excessive intake can potentially raise blood pressure in some individuals. Are there any alcoholic beverages that are safer for people with high blood pressure? Some studies suggest that moderate alcohol consumption may have cardiovascular benefits. However, excessive alcohol intake can raise blood pressure. If you drink alcohol, do so in moderation, up to 1 drink per day for women and up to 2 drinks per day for men. What are some healthier alternatives to sugary foods and drinks? Instead of sugary drinks like soda and fruit juices, opt for water, herbal tea, or unsweetened beverages. For sweets, choose fresh fruits, plain yogurt with honey, or dark chocolate in moderation. Can I ever eat out or enjoy fast food with high blood pressure? Eating out is possible, but it's important to make wise choices. Look for restaurants that offer healthier options, such as salads, grilled dishes, and dishes with lower sodium content. Limit fast food consumption and opt for healthier menu items when available. How can I determine if a packaged food is high in sodium? Check the nutrition facts label on packaged foods. Look for the sodium content per serving and be mindful of the serving size. Also, pay attention to the percentage of the daily value, DV, for sodium, aiming for foods with lower percentages. Is it necessary to completely eliminate all high-sodium foods if I have high blood pressure? Complete elimination may not be realistic, but it's crucial to significantly reduce high-sodium foods in your diet. Gradually making these changes can help you adapt to a lower sodium lifestyle more easily.